body.
Question number 6, Paul Foster-Bell.
Kia ora, Mr Speaker. Sir, my question is to the Minister of Health and asks, what reports has he received on patients receiving better access to health specialists?
Good question.
Honourable Tony Ryle.
Mr Speaker, 2 days ago I told the House the positive news that a record 294,000 patients had received surgical first specialist assessments in the last year. Today I'm pleased to report to the member some more positive news. The total number of medical first specialist assessments in 12-13 year was a record 194,000 extra patients, 22,000 up under this government. And this means that in the last year, a record 487,000 medical and surgical first specialist assessments were completed, which is really equivalent to around 1 in every 9 New Zealanders.
Supplementary.
Supplementary question, Paul Foster-Bell.
Supplementary to the Minister, what does recent data tell us about access to first specialist assessments?
Well,
Honourable Tony Ryle.
Well, Mr Speaker, there have always been people who don't meet the threshold for access to first specialist assessment. However, all patients referred to a specialist by a GP are assessed by hospital-based clinical staff, and those with the lowest clinical need are referred back to GP care. Often the patient has not met the threshold for a full assessment. Some decide not to take up the assessment, some move district and may no longer need the treatment. This data has never been centrally collected. However, copies of information received by my office indicates that around 45,000 people are triaged back to GP care by clinicians, and with around 490,000 assessments completed, this number sits at less than 10% of total people referred and has been reasonably static.
Supplementary question, Kevin Haig.
Thank you, Mr Speaker. Why has the Minister taken no action to address the concerns of district health boards published in the Ministry of Health's report into his elective surgery program in June this year, that the day-to-day pressure of pushing increasing numbers through waiting lists is, and I quote, diverting resources from the robust consideration of the longer-term strategy and impact?
Honourable Tony Ryle.
Mr Speaker, the government sees itself as the agent of patients, and patients tell us that they want improved access to the services that there are, and this government's put an average of $500 million extra into the health budget each year.
Supplementary.
Supplementary question, Kevin Haig.
Will he now confirm to the House that more than half of the 1,000 new doctors he and the Prime Minister have been claiming to have recruited are in fact junior doctors and not specialists at all?
Honourable Tony Ryle.
Mr Speaker, I think the Prime Minister and myself have always been clear that the increased numbers refers to all doctors. And in the term of our government, as that member knows through a large amount of Official Information Act material we've given him, we currently think we're running at over 1,200 extra doctors in our New Zealand public hospitals.
Wow, fantastic.
Supplementary, Mr Speaker.
Supplementary question, Kevin Haig.
Thank you, Mr Speaker. Given that all of the government's own district health boards and the Association of Salaried Medical Specialists have agreed on the need for at least 209 additional senior doctors every year, how does he defend his underperformance in recruiting at less than 3/4 of that rate?
Mr Speaker,
Honourable Tony Ryle.
As the member will know, we have over 1,200 extra doctors working in the New Zealand public system since 2008. There's also a lot of information which shows that the most stable workforce in the entire New Zealand public service is the senior medical officers. So our government's been investing very strongly in health. Turnover in staff numbers is down, and we have more frontline staff than ever before.
Speaker.
Point of order, Kevin Haig.
My question related to the recruitment of senior medical officers, and the Minister has not referred to that matter at all in his answer.
A member should re-look at his question. The essence of his question is how did the Minister defend his underperformance in relation. The member gave a very justified answer to that.
Supplementary then, Mr.
Supplementary question, Kevin Haig.
Well, can the Minister then confirm that New Zealand still has the worst ratio of senior doctors to population in the OECD and explain why he has not taken the steps to implement the plan agreed on by all DHBs and senior doctors.
Honourable Tony Ryle.
Mr Speaker, I think the member will find that New Zealand's ratio of senior medical staff to general population is relatively consistent in terms of international comparison, which reflects the different models of care that we have in New Zealand. But look, I have to say to the member, he can ask as many questions as he likes. It's not going to get away from the fact that we've got 1,200 extra doctors on the public payroll because of the strong investment our government is making in improving services.
Point of order.
The Minister has indicated he's happy for me to ask further questions, and I'd be...
That's not a point of order.
Be very pleased to take up the offer.
Supplementary question to Urara Flavel.
Thank you, Mr Speaker. To the Minister, how do these results that he quoted in the initial response correlate to the significant disparity in outcomes for Māori, especially hard to reach whānau, for example, the number missing out on before school checks?
Honourable Tony Ryle.
Thank you. I thank the member for the question. Yes, a lot of effort is going in by district health boards to make sure that those people who are offered first specialist assessments are provided the most, all opportunities to make sure it's at a time that best suits them. And with respect to the area of before school checks, the government's working very hard to expand the number of before school checks and particularly improve performance on those most at-risk children in our community. And I can report to the member that most district health boards around the country, the national averages, we have been improving that performance, particularly for our young people at risk.
Question number 7, Honourable Mary Ann Street.
Thank you, Mr Speaker. My question